Hello and welcome to our poster. This poster describes a recent systematic review of the literature entitled Triggers for Referral to Specialized Palliative Care in Advanced Neurologic and Neurosurgical Conditions. We know that studies now clearly demonstrate what has always been known by those in clinical care, that the care needs of individuals with life-limiting and life-threatening non-oncologic neurologic and neurosurgical conditions, particularly at advanced stages of illness, are substantial and are not being met by current standard care practices. The care needs in neurologic conditions are high but variable between conditions, and the most appropriate timing for initiation of neuropalliative care is not clear due to the variability both within and between conditions. Additionally, the palliative care needs of individuals with neurologic conditions differ from individuals with other advanced illness in both symptom burden and type, as well as the general trajectory of their illness. Discomfort with palliative care amongst neurologists and knowledge variability increases the likelihood that neurologists will initiate neuropalliative care at different times. Clearly identified trigger criteria may help neurologists to develop a deeper understanding of when to refer and what palliative care can offer. The aim of this study was to use a systematic review approach in order to investigate the most appropriate trigger criteria for referral to specialized palliative care services in the neurosciences, with special attention to the timing and reasons for referral. Specifically, we were interested in the non-oncological patient population since the timing and reasons for referral are better delineated in people living with oncological illness. Our goal was to focus on neurological and neurosurgical illness for which there is less certainty surrounding referral trigger criteria. The systematic review was performed in accordance with PRISMA guidelines and also in accordance with SWIM guidelines. For those unfamiliar with the SWIM guidelines, they stand for Synthesis Without Meta-Analysis Reporting Guideline for Systematic Reviews. The literature search identified 1,748 publications, of which 22 were included for the systematic review. Group A studies were designed specifically to identify trigger criteria for referral and provided direct evidence. Group B studies were studies in which referral triggers were retrospectively reported, but this was not the main intent of the study, and these provided indirect evidence. Overall, we found that many published referral triggers for non-oncologic, neurologic, and neurosurgical conditions are based on expert consensus. There is no evidence to support general trigger criteria applicable to all non-oncological, neurological, and neurosurgical conditions. Recent research does, however, provide evidence-based triggers for referral to palliative care in neurodegenerative conditions as a whole, and with condition-specific triggers being identified for Parkinsonism, multiple sclerosis, ALS, and dementia. We found that most adult studies focus on a diagnosis-specific trigger. In pediatrics, there exist consensus-based triggers for referral to palliative care, but there are not yet any specific evidence-based referral triggers beyond expert consensus. Unfortunately, there are no evidence-based referral triggers identified for neurosurgical conditions. An important issue that we identified within the literature was ambiguity with respect to nomenclature. Most studies use terminology such as triggers or reasons for referral. However, some studies use needs assessment tools as their main terminology. There is some crossover with respect to the type of tool being developed and the nomenclature used. This is most relevant when we consider how to use tools in future studies or daily practice. In general, needs assessment tools are designed to assess palliative care needs of a person and to track these needs over time. This enables clinicians to determine the responsiveness of symptoms to an intervention. In contrast, tools that identify referral triggers are designed to identify who should be referred to palliative care services and when. In conclusion, this systematic review compiled data from referral trigger criteria from over 2,907 patients. Variable nomenclature within the literature is a barrier to both research and incorporation of tools into clinical practice. That said, there is a growing body of literature providing evidence-based referral triggers for neuropalliative care, and condition-specific triggers are likely to be the most effective tools for identifying the appropriate people and timing for referral to specialized palliative care.